How is a muscular dystrophy muscle biopsy sample processed? Have you ever wondered how a muscle biopsy is processed when diagnosing muscular dystrophy? It's a detailed and careful process that helps doctors understand muscle health. Let's break it down step by step. First, a small piece of muscle tissue is surgically removed from the patient. This is usually done under local anesthesia, meaning the area is numbed, but the patient remains awake. The doctor makes a small incision over the muscle to access it. This procedure is performed in a sterile environment to prevent any infections. After the muscle is exposed, a small fragment is carefully excised. The goal is to minimize damage and bleeding. Once the sample is taken, the incision is sutured in layers to help it heal properly. Immediately after removal, the muscle biopsy sample is placed in a sterile container. To keep the tissue intact for analysis, it is often wrapped in gauze that is moistened with saline and quickly frozen. This rapid freezing is crucial because it stops any enzymatic activity that could break down the tissue, preserving important proteins and enzymes needed for further examination. Next, the muscle tissue is divided into parts for various specialized tests. This is important because muscular dystrophies are linked to defects in muscle proteins and cellular structures. One part is frozen for enzyme histochemistry, immunohistochemistry, and biochemical assays. These tests help identify specific muscle proteins, such as dystrophin, which are essential for diagnosing different types of muscular dystrophy. Another portion is fixed in glutaraldehyde for electron microscopy. This step preserves the fine details of muscle fibers, allowing for a closer examination of cellular components. If there is enough tissue, a small piece is also fixed in formalin to prepare standard histological slides for light microscopy. This helps assess muscle fiber size, shape, and any signs of inflammation or fibrosis. Once in the laboratory, the frozen tissue is cut into thin slices using a cryostat. These slices are then stained for histochemical and immunohistochemical analysis. The stains help highlight any abnormalities in muscle fibers or enzyme deficiencies. The samples prepared for electron microscopy are embedded and sectioned very thinly to be examined under an electron microscope, revealing ultrastructural changes. The formalin-fixed tissue is embedded in paraffin, sectioned, and stained with routine dyes to evaluate general muscle pathology. After all the analysis, a pathologist who specializes in neuromuscular diseases reviews the stained slides and electron microscopy images. They combine findings from histology, immunohistochemistry, and biochemistry to determine the type and severity of muscular dystrophy. This comprehensive analysis typically takes several weeks, and the results are then sent to the referring physician to guide diagnosis and treatment planning. Lastly, any remaining tissue is stored for potential future testing or research. This is important because it allows for additional analyses if new diagnostic techniques arise or if further confirmation is necessary. In summary, processing a muscle biopsy sample for muscular dystrophy involves careful surgical removal, rapid preservation, division for specialized tests, detailed analysis, and expert interpretation. This thorough process is vital for accurately diagnosing muscular dystrophy and determining the best clinical management for patients.